a pocket companion for a healthier you. An innovation project proposal for the Health to Sync by Ismail Estopa. Hello everyone, my name is Ismail Estopa. You're watching an innovation project proposal for Health to Sync, which is a mobile health application specifically developed for patients diagnosed with diabetes. For the sake of organization, in this video, I will be tackling 5 major questions that can further your understanding on Health to Sync. The questions are the following. 1. What problem will the innovation project solve? Number 2. What is known about this problem? Number 3. With whom did you collaborate when working on your proposal? Number 4. What mobile app did you propose to use to solve the problem? And number 5. Why is your proposed solution innovative? Hopefully, this video will help you gain more knowledge on the diabetic epidemic of the United States and the measures being taken to improve the practice of diabetic management. The first question: what problem will the innovation project solve? The 2021 Diabetes Update of the Center for Disease Control and Prevention states that there are more than 37 million individuals in the United States who have diabetes. 1 in 5 are unaware of their condition. Meanwhile, for pre-diabetes, there is an estimate of 96 million for adults in the United States alone. More than 8 in 10 are unaware of their condition, according to Center for Disease Control and Prevention, year 2021. Diabetes continues to be one of the prevalent chronic diseases in the country. It is also ranked as the 7th leading cause of death, according to Center for Disease Control and Prevention, year 2021. Such a fact places significant financial burden not just to individuals affected by the disease, but to the overall society as well. This is because, according to the CDC, the country annually releases an estimate of $327 billion for the medical needs of diabetic patients and also for their lost work in wages. From the facts that have been mentioned, one can easily come on to the conclusion that diabetes is a public health concern that must not be ignored. One's quality of life is dependent on how early he or she is diagnosed, screened, and then treated. Aside from medications, diabetics and even pre-diabetics individuals must make lifestyle changes, primarily by incorporating physical activity in their daily routine and ensuring that they have balanced diet. What problem will the innovation project solve? Understanding the risk factors is one of the ways in which an individual can decrease the possibility of developing diabetes or of exacerbating his or her current condition if he or she is already diagnosed. There are 4 types of diabetes: type 1 diabetes, type 2 diabetes, pre-diabetes, and gestational diabetes. Type 1 diabetes is known to be a result of an immune reaction. Example, the body mistakenly attack itself. The main risk factors for type 1 diabetes are age and family history. For the former, one should note that type 1 diabetes can develop at any age, though it is likely to occur during childhood or adolescence. As for the latter, the possibility of developing type 1 diabetes is increased if one happens to have a family member, example, parent or sibling, diagnosed with it too. As for type 2 diabetes, the risk factors are: 1. If one already has a pre-diabetes. 2. If one is overweight. 3rd, if one is age 45 or above. 4th, if one has a family member diagnosed with type 2 diabetes. 5th, if one does not regularly engage in physical activities. 6th, if one has gestational diabetes or give birth to a baby weighing more than 9 pounds. And if one also diagnosed with non-alcoholic fatty liver disease. The CDC states that African Americans, Alaskan Natives, American Indians, Asian Americans, Hispanic or Latino Americans, and Pacific Islanders are more vulnerable when it comes to developing type 2 diabetes, and so they are advised to regularly monitor their condition. Moving on to prediabetes, The risk factors are if one is overweight, if one age 45 or above, if one has a family member diagnosed with type 2 diabetes, if one does not regularly engage in physical activities or if one had gestational diabetes and gave birth to a baby weighing more than 9 pounds. Indeed, the demographics are closely similar to those type 2 diabetes, which are African Americans, Alaskan Natives, American Indians, Asian Americans, Hispanic Latino Americans, and Pacific Islanders are also more vulnerable when it comes to developing prediabetes. Lastly is gestational diabetes. This is known to usually go away after one's pregnancy, though it increases one's risk of having type 2 diabetes. Gestational diabetes also affects one's baby. If not monitored, the baby is likely to become obese during childhood or adolescence. He or she may develop type 2 diabetes in the future too. The risk factors for gestational diabetes are the following. 1. If one already had gestational diabetes. 2. If one gave birth to a baby weighing more than 9 pounds. 3. If one is overweight. 4th, if one is older than 25. 5th, if one has a family history of type 2 diabetes. 6. If one diagnosed with polycystic ovarian syndrome or PCOS. African American, Alaska Natives, American Indians, Asian Americans, Hispanic, Latino Americans, and Pacific Islanders are also those who are more vulnerable when it comes to developing gestational diabetes. So the second question to be answered is, what is known about this problem? As mentioned earlier, the CDC revealed that the United States annually allocate $327 billion for diabetes cost alone. This is supported by the general data shared by the American Diabetes Association to the public. From $245 billion back in 2012, the spending jumped to $327 billion, which is 26% increase in just 5 years. According to the American Diabetes Association, the four major contributors to the expenditures are hospital inpatient care, which is 30%, prescription medication for diabetes complication, which is 30%, anti-diabetic agents and other supplies for diabetes, which is 15%, and face-to-face consultations with physicians, which is 13%. There are also indirect costs to consider. This places a significant strain on societal productivity, for diabetes complications are known to prevent one from being able to fulfill more social responsibilities. The indirect costs are increased absenteeism amounting to an estimate of $3.3 billion, reduced productivity among the employed amounting to an estimate $26.9 billion, reduced productivity among the unemployed amounting to an estimate of $2.3 billion, inability to seek employment because of diabetes-related disabilities or disabilities amounting to an estimate of $37.5 billion, and lost productivity capacity due to early death amounting to an estimate of $19.9 billion, according to American Diabetes Association. What is known about this problem? Extensive literature points to the implementation of lifestyle intervention such as diet, exercise, and modest body weight reduction as effective for those who are diagnosed with diabetes. In determining the appropriate interventions for a patient, a healthcare provider must of course familiarize himself or herself with the living condition of the patient, as these indicate whether or not the patient is capable of maintaining, let alone starting, the interventions. For an at-risk individual to exercise consistency in his or her intervention, he or she must be provided with adequate education and ongoing support. A safe environment that promotes health-enhancing behavior is a great advantage as well, especially for those whose living condition may not suffice, like unsafe neighborhood for exercising. Healthcare providers in facilities can offer various opportunities to diabetic and pre-diabetic individuals, such as counseling, referring to relevant programs and or resources, and behavior screening. Example, to detect unhealthy behaviors with the use of health information technologies. These opportunities empower diabetic and pre-diabetic individuals to be more involved in their care, as they are already made aware of a support system in healthcare that they can turn to. Then, what is known about this problem? Aside from lifestyle intervention, patients diagnosed with diabetes are also required to practice diabetes self-management in order to keep track of changes with their condition and also to determine the necessary steps to be made in one lifestyle. The complexity of diabetes self-management depends on what has been discussed by a patient with his or her health care provider. Typically, though, a patient must strictly monitor vital personal factors such as diet and blood glucose. Although diabetes self-management started through manual input, like a template is provided to the patient, the advancement in technology now make it possible for a patient to input various data and even share them to his or her provider and or loved ones in just few minutes. In diabetes self-management, a patient must be capable of regular making complex decisions in his or her self-care. Therefore, it is important for a patient to first undergo diabetes self-management education in order to acquire the knowledge and skills that can make diabetes self-management on its own a success. The common barriers implementing a technology-assisted diabetes self-management routine are: 1. Poor technological competence. Second, poor literacy and language barriers. There is also, of course, the question of whether or not a patient can afford a device, example, a smartphone, that is capable of running the health application on diabetes health management that the healthcare provider has chosen. And the patient does have a device that can run the chosen health application. Is the health application entirely free? Will the patient need to pay further to access all the features, or will the free version suffice? Such questions must all be cleared by the healthcare provider and patient before proceeding with a technology-assisted diabetes self-management routine, as whatever health application is chosen will play an important role in the patient's treatment. Like what's happening now with my patients before this app came out, they usually monitor their blood sugar the usual way, one that is taught by every provider to check their blood sugar before meals and inject the appropriate insulin needed. The, the problem that came out usually is that they cannot monitor properly and take care of the necessary insulin injection as scheduled, especially if they're working. Diet and exercise are also not followed as usual. So what came out usually are their sugar are not controlled. So the third question, with whom did you collaborate when working on your proposal? Early on their education, healthcare providers are already asked to acquaint themselves with the stakeholders of healthcare, as the perspective of these stakeholders would always prove vital in undertaking that seek to improve the healthcare system. The stakeholders of healthcare are the patients, payers, policymakers, and providers. Collectively, they also go by the name the 4 Ps. Patient encompass stakeholders as all people avail health-related services. Furthermore, patients are always affected positively or negatively by the changes that occur within the healthcare system. Meanwhile, payers are those who are responsible for the financial aspect of the policy framework. They avail health-related services from the providers on behalf of the patient who are their beneficiaries. As for policymakers, these are the ones who develop and implement the framework within which healthcare is made available to the population. The policymakers have the responsibility to gather vital data from patients, payers, and providers so as to be able to create accurate population level metrics to be referred to when it comes to policy making. Lastly, providers are those who deliver various health related services within the policy framework according to Joint Learning Network. Many providers are independent. This means that they are responsible for their own finances and operations. For the innovation project proposal, I sought the perspective of healthcare providers and a patient of mine. I decided to cover the patient and providers of the 4Ps as they are the ones most exposed to the technological implementation in healthcare. In the brief collaboration for the innovative project proposal, I asked my interviewees 4 questions that resolve not just around my chosen mobile health application, but around the presence of technology in healthcare as a whole as well. The 4 questions were: 1. What is your opinion on the role of mobile information technology in evidence based practice? Number 2. How vital is mobile information technology in modern nursing and healthcare in general? Third, what are some social, ethical, and or financial costs that comes with the implementation of mobile information technology in your practice and in nursing in general? And fourth, what advice can you give with regards to the development of an innovation project proposal? The healthcare providers I interviewed agreed that mobile information technology allows the faster dissemination of evidence-based intervention and also bridges gaps in provider and provider-patient communications. Furthermore, mobile information technology make it possible for patients to send relevant updates to their providers anytime and anywhere. Of course, the provider interviewees are also mentioned another benefit for them this time, which is that the extensive and easily accessible information provided by mobile information technology contributes to the reduction of medical errors. As for the incorporation of a mobile health application such as Health to Sync into a treatment, the provider interviewees mentions that accessibility and training for both provider and patient must be taken into consideration. Meanwhile, in the development of an innovation project proposal, they advise the need to first identify the public health issue that must be addressed and then to establish a time frame so as to ensure that the project is being guided. For the patient that I interviewed, she stated that mobile information technology has increased knowledge production, not just in healthcare, but in other fields as well, for countless information can now be accessed through portable devices. My patient also mentioned how mobile health information is a vital factor in the shaping of healthcare and how it benefits from the advancement stemming from the continuous production of knowledge. As to the discussion of the incorporation of mobile health application into a treatment, once again, my patient said that patients, especially the elderly, such as her, should be assured of adequate education so that they will have ease with navigation, the mobile technologies that would be introduced to their treatment. Moreover, she said that a time frame is vital for an innovation project proposal. The interviews proved to be helpful in my development of the innovation project proposal for Health to Sync. I further learned about the factors that must be considered in order for a mobile health application to become a success among providers and patients. The fourth and fifth question: what mobile app did you propose to use to solve the problem? Why is your proposed solution innovative? I have decided to combine the question as both as similar sub-questions. Here is a preview of the mobile health application known as Health to Sync. As mentioned earlier, Health to Sync is catered to patients diagnosed with diabetes, and its goal is to make diabetes health management efficient. Before diving into the feature of Health to Sync, it is important to first discuss the history of this mobile health application. Health to Sync was established back in June of 2013 and then officially introduced to the public in September of 2014. The developers envision a healthcare platform that is capable of making diabetes self-management easier through features that are easy to navigate. According to the official website of Health to Sync, it is estimated that 10% of the global population has diabetes and more than half resides in Asia. There are countries that have inadequate resources for healthcare in such especially places significant strain for those with chronic diseases such as diabetes. Health to Sync aims to empower diabetic patients around the world to take care of their health with the use of smart tools and resources. Specifically, Health to Sync targets four issues, and these are: one, incomplete recording blood glucose, especially when done on paper; hesitancy in communicating with providers, as patient does not know which concern must be raised; third, hesitancy in modifying daily habits when blood glucose is unstable due to inadequate education; and fourth, demotivation that comes with feeling as if one alone in his or her journey to lead a healthier lifestyle. Health to Sync can be downloaded from both the Google Play Store for Android users and App Store for iPhone users. It is therefore an accessible mobile health application. Health to Sync allows diabetic users to record vital information such as blood glucose, blood pressure, diet, medication, mood, and physical activity. A user may also upload photos in his or her account. Indeed, Health to Sync is a comprehensive digital companion that can make consultation easier to follow. The record in Health to Sync can be converted into either a PDF or an Excel format, and then in turn emailed to oneself and or someone else, such as one's healthcare provider. This function is available for the first 3 times for those utilizing the basic membership. Even with the free version of Health to Sync, one can already make considerable changes in his or her self-management of diabetes. Worth noting as well is that Health to Sync has a partners function which allows users, healthcare providers, and or loved ones to also monitor the logs being made in the application. Partners can send messages to a user such as a reminder to consult with healthcare provider, or even simply an encouragement to push with the treatment. During the phase of scoring relevant literature for the innovation project proposal, I have learned the value regarding the incorporation of mobile health application into healthcare. It is vital for a healthcare provider to employ a hands-on approach when incorporating mobile phone application in the treatment of patients diagnosed with diabetes. Patients prefer mobile health applications that have user-friendly features and that also encourage proactiveness. Specifically, there's a strong preference for mobile health applications that promote healthy eating, monitor blood glucose and physical activity, and provide diabetes education and data analytics. The need to educate patients, especially the elderly, on the incorporation of technology and healthcare is emphasized, as this shall encourage the development of positive attitude, especially in technology-assisted self-management of chronic diseases such as diabetes. What makes Health to Sync a strong contender for mobile health applications that are designed for diabetes self-management is the fact that even its free version already has various features that can make diabetes self-management more organized for the user. Of course, before assigning such an application to a patient, the patient must first be taught how to properly navigate it in order to maximize the benefits. This concludes my innovation project proposal on Health to Sync, and thank you everyone for watching. These are all my references. Thank you.